Hi, and happy National Doctors Day. I'm Dr. Gettings, and I'm so excited to be a part of the medical community where I'm able to spend most of my time providing information to those in need and helping a lot of patients get some answers that they haven't been given. I went into medicine because I have a passion for understanding biology and also helping others. And although I've been a doctor for over 10 years, I must say that as I continue on in this profession, I see a lot of pitfalls that need to be corrected sooner than later. As most of you know, when it comes to Western medicine training, we are trained in certain specialties, and those specialties can range from cardiology to pulmonary medicine to obstetrics and gynecology, or the field that I am trained in, which is adult psychiatry and also child and adolescent psychiatry. And what I'm seeing is that a lot of times we, as trained doctors in our specialties, we become a bit compartmentalized. What I mean by that is we forget the impacts that other systems can have on the system that we actually are trained to treat and hyper focus on. So I want to share a recent experience that I had as a clinician working with an individual who presented with a past diagnosis of a primary psychotic disorder, specifically schizophrenia, and how, when meeting with this person, I looked at all of the clinical history and their presentation, and I was not in agreement with their diagnosis. And so I proceeded to pursue additional testing and also sought to get the involvement of a local hospital in order to get some imaging. And the experience that I had, honestly, it doesn't frustrate me as much as it saddens me because I know it represents the likelihood that many individuals who are looking for answers are faced with a lot of barriers when they are treated in the outpatient and inpatient setting. And this situation really struck home because the stigma that is associated with being diagnosed with a psychotic illness unfortunately seems to prevent members of our medical community from really looking more closely at other underlying causes. We have to understand and accept the fact that when your brain is not well, it doesn't just present with symptoms of, let's say, headaches or seizures. Most of us, when we have those symptoms present, we do a workup, we look for underlying triggers. But unfortunately, when other areas of the brain are inflamed, like the limbic area or the temporal lobes, the brain may let you know that it's sick by presenting with hallucinations or presenting with suicidal thoughts and sleep disturbance. And we have to do a much better job in the medical community with identifying these underlying causes and not just being quick to diagnose a person with a primary mood disorder or psychotic illness. In the case of the individual that I have had the privilege of working with very closely over the last 2 weeks, this person was discharged from the hospital with no definitive diagnosis from infectious disease and was advised to come back and see me as the psychiatrist because obviously the symptoms were consistent with a primary psychotic disorder. Well, thankfully, before sending this individual for imaging and trying to collaborate with infectious doctors, I proceeded to rule out certain suspicious underlying pathogens that I had. And I have to be honest, I am trained as a psychiatrist, just like many others are. And in your standard training, we are not, excuse me, we are not educated about the plethora of toxins, both environmental and also caused by pathogens, that can mimic primary psychiatric illness. And thankfully, since I have worked with the Amen clinics and had the privilege and honor to follow the treatment protocols and testing that our functional doctors perform, I was able to proceed with helping this individual get more information while collaborating with the functional team. And I am happy to say that with persistence and with the appropriate testing, I was able to confirm that this person, in fact, does have exposure to Lyme disease. A lot of us may not be familiar with how Lyme disease is passed along. It is considered a vector-borne illness, meaning that you come into contact with the bacteria that causes Lyme disease through a vector, meaning a third party. In this case, it would be a tick. A lot of individuals have had tick bites, but are not aware that if they have Lyme disease, symptoms like light sensitivity, sleep disturbance, brain fog, mood swings, panic, anxiety, psychosis, paranoia, persecutory delusions, and even suicidal thoughts can show up as a sign of your brain trying to let you know that it has been invaded by a pathogen. So on today, National Doctor Day, I want to say thank you to Dr. Ebony Cornish and to the Amen Clinic family for always taking the lead in digging deeper. When I first started working with Dr. Amen, he said MD stands for medical detective. And that's exactly what we all should be exercising, a little detective work. Let's not get so fixated on putting a diagnosis on someone just because it meets criteria in the DSM-5 and forgetting to look for other causes of neuropsychiatric symptoms. I'm so happy to have had an opportunity to collaborate with Dr. Cornish, and I'm even more excited for the program that Amen Clinics will soon be offering in Reston, Virginia, for those individuals who have struggled with neuroinflammatory symptoms that can be secondary to infections of the central nervous system. And most of all, I am so thankful to be able to share a accurate diagnosis with someone that I'm confident is on their way back to wellness. Happy National Doctors Day. Share this message with someone and know that if you are suspicious that you have not been diagnosed correctly, you can advocate for yourself. If you are interested in learning more about functional psychiatric evaluations, you can email me at info@drgettings.com and have a great weekend.